Hello, today we are going to discuss about Omicron diagnosis and important update. So the whole world is facing the third wave due to Omicron variant. So we are going to discuss about the recent updates in the diagnosis. Any variant or any new strain, people very curious about four facts. Its effect on transmission. So it's well proven Omicron is transmissibility is more than the existing Delta and other variants. High transmissibility. It's proven one. Second is virulence. At present, comparing with the existing Delta strain, virulence is less because it is not going to lower respiratory tract. Only the upper respiratory tract infections are reported, and the oxygen, everything is need of oxygen, everything is less now because of one is vaccination and the nature of the virus. And third important one is diagnosis. Will it affect the diagnosis? We can say yes and no. In Indian setup, Indian PCR laboratory, we can diagnose SARS-CoV-2, but we cannot diagnose Omicron variant. No confusion. We can diagnose SARS-CoV-2, but not. We can't say whether it's Delta or Omicron at present existing setup. And next very important thing is, will it affect the vaccine efficacy? A little bit, not having full data, but it can infect the already vaccinated people also. Some cross protection will be there. Still, we need some data. Next is, what is the protocol for diagnosis of Omicron? Current protocol number one, perform the COVID 19 RT-PCR testing routinely as usual. What you are doing previously, the same thing. Collect the nasal swab or oropharyngeal swab. Do routine RT-PCR with a special kit. Usually, the existing kit, it can detect two genes in India. One is N gene, nucleocapsid. Another one is E gene, envelope gene. But new kit, they're giving to detect spike protein, S gene. So the new kit is targeting three genes. That's one add-on feature. If we do the detect the three genes, especially we need to concentrate on spike gene, S gene. Is S gene is detected? If yes, it is detected, it is less likely or unlikely to be Omicron because the mutation is happening on S protein, S gene. If no, then it could be Omicron. So this technique is called S gene dropout. We call it as S gene detection failure or S gene dropout. It may be Omicron. What we need to do, we can't say it's Omicron. It could be Omicron. It's a screening test. Second step, we need to send it for whole genomic sequencing. It will confirm. It's almost gold standard test to confirm it is Omicron. Omicron strain or Omicron variant. What is the drawback? One practical drawback, a country like developing country like India is waiting for the results of genomic sequence because only few laboratories available and more number of samples. See the population, more number of samples, overburdening the laboratory. Number two, the cost, almost around 6,000 to 10,000 rupees per sample. Developing countries like India, it is very difficult to bear and very practically it is difficult to do every sample for genomic sequencing. So now we have a new test called Omisure. Omisure, it's a ray of hope detecting Omicron variants. How? See here, this is called Tata MD Check RT-PCR Omisure kit. It is it's developed with the collaboration of by two people. One is Tata Medical and Diagnostics and our Indian Council of Medical Research. With collaboration of the two big units, they developed a kit called Omisure which can detect Omicron. How? The basic point, This is the India's first homegrown Omicron detecting RT-PCR kit. We have many vaccines we have developed. Homegrown vaccines are there. But first homegrown Omicron detecting RT-PCR kit is this one. Number two, it is properly approved by Drug Control General of India. Recently we got the approval. Third, it is also approved by ICMR for the detection of Omicron variant SARS-CoV-2 in 30/12/2021. Next is, what is the mechanism? It identify Omicron variant as well as other circulating variants like Delta, Alpha, Beta, other people. So unique. And usually, globally, we have two type of kits to detect Omicron. One is S gene dropout or S gene target failure. So that kit will not detect S gene. That is one set of things. Another thing is specifically they find S gene mutation. So we have two type of kits, but first time in the global, a kit uniquely incorporate these two techniques is Omissure. It has two steps. It will do S gene dropout or S gene target failure, as well as second step, it will find S gene mutation amplification. Unique, it is a combination of unique. And everybody has the basic doubt. Sir, I need any special laboratory, any special equipment or anything. No need. Existing RT-PCR laboratory, existing RT-PCR equipment, you can perform the test. No need to spend extra penny except that reagent. Second, so how long it will take? As usual, around 4 hours. Turnaround time will be 4 hours. And $1 million question, what is the cost? Believe, as the company says, it is per test around 250 rupees. Genomic sequence around 6,000 to 10,000 rupees per test, and you need to wait for days. Here, matter of 250 rupees, we can do the test. Next is, everybody have the question, okay, what about the sensitivity, specificity and validation? Till it is not introduced, just they got the permission. We are not getting the real ground data, but it is validated by ICMR, National Institute of Virology, Pune, one of the Apex Institute. As per the MD of the Tata MD told, when comparing with ICMR results and their results, it correlates around 100%. It picks all the sequencing things. Whatever the sequence as Omicron, it picked. And the conclusion, number one, definitely again I'm saying it's a ray of hope in detecting Omicron variant. It's a revolution. We can detect more number of Omicron cases. Based on that, we can change the little bit treatment and other thing, quarantine, everything. Second, it is highly time saving and cost effective test which is need of the hour for developing countries like India. And if it's proven, the efficacy in ground, it is proven, definitely it's a game changer. It is an ideal alternate for gene sequencing. We don't need to go for gene sequencing. We can do this everywhere we can do, because everywhere we have RT-PCR equipment. So same equipment, you can use it for this one. Really it's going to be a game changer. And it's my special mention. Dr. Vasantapuram Ravi is a eminent, famous, dynamic, national level virologist who is inspiring many microbiologists like me, and he is head research development Tata Medical Diagnostic Center, and the nodal officer and chairman of COVID-19 Whole Genome Sequencing Committee, Karnataka, former head of the department Neurovirology and NIMANS. Lot of other titles are there. Is the man behind the show. We salute, sir. Thank you. And for more updates, stay tuned. Thanks again.